So the radial nerve is the nerve that supplies extensors of the arm and extensors of the forearm for the wrist and the fingers. It also supplies a supinator muscle as part of the extensor supinator group and the brachioradialis muscle. The only muscle that the radial nerve supplies above the elbow is the triceps muscle, and you should examine the triceps muscle both with the elbow in extension and in flexion, and assisted with gravity and against gravity. So first of all, we'll just examine the station of the arm by having the subject hold the arm strong, and I'm going to try to overcome him, and I cannot overcome him because of his strong triceps muscle. If I have him rotate his arm this way, can you straighten this arm out? You can also see the muscle very well here as I try to forcibly try to overcome the triceps muscle. So you can see the muscle very well there. And lastly, we can also have him hold the arm up and now straighten out the arm. And now he's in almost full extension. I'm going to ask him to hold it there, and I'm going to push against him. So those are the different ways to examine the triceps muscle. The next muscle we're going to examine is the brachioradialis muscle. I'm going to examine that on both sides to illustrate the muscle bulk as well. So I'm going to ask him to flex his elbow and his wrist up against my hand. Go ahead. And you can see the muscle here acting, but sometimes you'll see it better on the other side from this angle, and you can see the muscle nicely there as I try to overcome him, and there's a muscle nicely shown, the brachioradialis. After that, the nerve dives into the supinator muscle mass, which the supinator muscle will help supinate the forearm on the arm. So can you bring your palm up like this and completely hold it up? I'm going to try to turn you down, don't let me. So I'm actually testing both the supinator muscle and the biceps muscle. I can try to eliminate biceps by completely and forcibly extending his elbow. Keep your palm up, don't let me turn it down. And now I'm testing almost exclusively the supinator muscle here. After the supinator muscle, the radial nerve innervates the wrist extensors, the extensor carpi radialis longus, brevis, which extend in a radial direction, and the extensor carpi ulnaris, which extends in an ulnar direction. But first and foremost, I just want to see if you can extend his wrist. So I'm going to just ask you to stop traffic on both sides. I'm going to try to overcome you, and you can see I can't, and I'm noticing that his wrist is extending in a very neutral position, which is what I want to see. I'm also noticing that he's able to extend his fingers at the MCP joint, so I also get a very good sense that his extensor digitorum communis is working very well with this maneuver. Now, what I'm going to do is I'm going to ask him next to extend his fingers collectively, so bring the fingers back and hold them back, and I'm testing his finger extensors. But the best way to really get an appreciation for this is to have him rest his hand on a surface and ask him to individually lift his fingers up. And here I'm asking him to extend his index finger, hold it up, now the middle finger, now the ring finger, and now the little finger. And each one of them is individually assessed with regards to finger extension. And finally, I'm going to have him extend his thumb. So this extension is more in this direction, and then abduction with the long abductor is in that direction. Hold it there. I'll do it this way so we can see that better on the video. So I'm testing long finger or long thumb abduction with that maneuver. And those two tendons, the long abductor tendon and the extensor digitorum tendon to the thumb, make up the anatomical confines of the anatomical snuff box, and that actually is the main area of sensory innervation for the radial nerve as well. So the zone of radial nerve sensory innervation is really the back of the wrist in the web space between the thumb and the index finger in this region here. So that completes the examination of the radial nerve.